everybody. This is Dr. Lori Shemek.
And I'm Omar Cumberbatch. You're listening to This Podcast Burns Fat. Hey, Lori, how are you today?
Hi, Omar. Doing great. Yeah, getting ready for fall.
Oh, I can't believe it's September and
Hey,
God.
welcome home, sir.
Oh, yes, thank you. And I'm excited to share this part of my destination, right?
Oh, do
Uh,
tell.
Yeah,
Yeah.
so as many of you know, and from the last show, I was going to Jamaica, and I don't know if I've said this on the show, but ever since I had our fight with the virus, I had developed psoriasis for the first time in my life. So I don't know if they had anything to do with each other, but I have psoriasis now, and it's mainly like on my shins now, and of course going
Mm-hmm.
to a sandy beach and being exposed out there like that, it didn't look pretty, and very quite embarrassing actually. And honestly, before the trip, is probably was the worst. Like it's flared up since I had it, so I've had it for like 2 years now,
Oh,
and
man.
in 3 days, completely gone.
Wow. Isn't that amazing? That is incredible.
Yeah, so I'm thinking it's
So it's never left you before, just this.
just now. Yeah, so like
That
I think
is.
it's yeah, I mean, and we've had this conversation, the stress reduction, the
Mm-hmm.
sun, the salt water,
The
maybe
sun. Yeah.
yeah, the sand, the food, obviously. Jamaica is pretty well known that they are very particular about what they put in their food. So that was amazing. Literally in 3 days, it
That
was.
is incredible.
And now that I'm back, guess what came back with me? The
I hate to
psoriasis
say it.
back.
Oh, I'm sorry. Isn't
Yeah,
that unbelievable though?
it's nuts. It's
It's crazy. It
so
just shows you, there's something going on in our country.
yes, there's no doubt about it. There's and it could be the food supply, the water,
Mm-hmm.
drinking water, the stuff that's in their air, and because we don't want to go down the crazy path, in its introduction because we got to
Or
get
all of the above,
right. Yeah, going back to work, getting stressed out, like that kind of stuff
Right.
plays a role. So
Yeah.
yeah, just wanted to let the audience know that yeah, something going on in this country
In the
for
United States.
sure.
Yeah. A
Yes,
lot of people say that they just feel so much better when they leave,
yeah,
you know?
and
Unless you're like me and you go to another country and get sick.
oh,
You
jeez.
come home to get better.
I know it's amazing, and that's another thing too. They do not have people a large overweight population by any stretch of the
Well, I
imagination.
didn't know that.
Mhm.
Okay.
Nope. Yep. It's very interesting.
That
But
is very well.
anyway,
I'm glad you're back and you all are safe and
yes,
happy,
yes. Thank
and your legs are,
you.
we'll have to figure something out there. But I think some type of patch of salt water or something.
Yeah,
Um,
so I got something. I gotta think of
we'll figure it out. Yeah.
something. Yeah,
Maybe if anyone in our audience has any ideas.
yeah, I appreciate it.
Yeah.
Give it to me.
Help him.
Yes, yes.
Well, that's a good heads up, Omar. And so, but today, our guest today is the wonderful Dr. Paul Kolodzik.
Yeah,
And he's a doctor and he's double board certified emergency and metabolic health physician. And he has 30 years of experience at helping people. He's helped thousands actually lose weight with the continuous glucose monitoring system, the CGMs that people are wearing on their body. And he talks about that. And he talks about how he's helped so many lose weight and have a better life. Because when you have your health, you have everything almost.
for sure, for sure. Yeah, very good show. Very
Hmm.
enlightening, and yeah, he touches on, of course, the glucose monitors, but he also talks about some in his practice about these drugs that are out there too, like Ozempic and all these popular drugs that people are kind of running to, and he definitely breaks down that he's not against it. He actually uses it in his practice on occasion, but he prefers us to do it the right way, really get
Yeah.
eye-opening experience with the glucose monitors because they actually show you data real time about what's actually messing with your blood glucose. So it's very helpful. Very
Yeah. In fact, he wrote a book on it called The Continuous Glucose Monitor Revolution.
yes, that
So it's about losing weight and living longer. I love that.
yep. Let's jump into it.
Okay.
Hey, Dr. Paul, welcome to the show. How are you today?
Thank you very much for having me.
It is so nice to have you, Dr. Paul, and we've been looking forward to your interview today because this is really what we're going to talk about today. Is not only is it extremely important, but it is something that's on the minds of a lot of people who want to lose weight and who want to become healthier, promote optimal health. So you work with your patients to create optimal health, metabolic health. And if you could just give us a little bit, a short, brief intro about yourself and then describe what metabolic health really is.
Sure. So I'm Paul Kolodzik. I'm an emergency physician and metabolic health physician in the Midwest. I'm in Southwest Ohio in the Dayton, Ohio area. And my background is in emergency medicine. I spent 25 years in the emergency department. And what gets all the press in the emergency department is the overdoses and the gunshot wounds and the multiple traumas. But really, what emergency physicians see every day in and day out, all day long, is the medical problems that result primarily from obesity and from vascular disease.
Well, that's
Vascular,
important. Yeah.
yeah, yeah, vascular diseases of the blood vessels, and I think the primary reason for that is the elevated blood glucoses that we have routinely in this country, pre-diabetes and diabetes. And though cholesterol has really been public enemy number one for the last 50 years, I really believe that blood glucose issues are at the forefront and lead to a lot of the problems we see, the heart disease, the peripheral vascular disease, the kidney failure. So a few years ago, I made a transition from the emergency department to my metabolic health practice.
That's awesome because, like you said, it's so much of a big issue and it's needed. We need more people like you in the field who are addressing these issues. I'm just curious, you did say something about the last 50 years in regards to cholesterol. Has that
Yeah.
opinion of changed, at least in your view? Because
Well,
I know it
yeah,
has
in
in
my
mine.
view, yeah, yes, absolutely it's changed. So, I won't get down into the weeds here, but you look at movies and photographs before 1960, you don't see a lot of obese people. We didn't have the prevalence of diabetes back then that we did today. And the food pyramid came out in 1972, and almost instantly we switched from a diet that was 25% carbs and 50% fat and 25% protein, and we switched those fat and carbs amount, and we ate a lot less fat because of the fear of cholesterol and a lot more carbs. And I think it's unquestionable if you look at the curves. The epidemic of obesity took off about 10 years after that, and then diabetic epidemic took off about 10 years after that. The curves, I think, are unmistakable. And so I think this focus on, reducing fat and, over focusing on cholesterol. I'm not a cholesterol denier. I believe it can be important for some people. But I think the issue for most people is the blood glucose related problem of insulin resistance. And in my practice, it's 10 to 1 where blood glucose is a bigger issue than cholesterol.
Yes, that makes so much sense, because we can talk about glycation and how that affects cholesterol, oxidizes it, and promotes, occluded um, arteries.
Yeah.
So if, what you're talking about is metabolic syndrome, and I guess I'm assuming you are, as part of what you see in the emergency room. And is this something that is directly from our diet, or is it lifestyle?
Yeah, I think there are a lot of forces that have taken place again over the last 30 or 40 years. And so to stay healthy, we're swimming upstream. There's the medical care system, which has really evolved into a disease management system. We don't look
Mm-hmm.
at prevention and reversing disease, but we look at what's the next medication we're going to use to treat a problem.
Right.
Um, so, it's different, quite honestly, than when I was in training way back in the 80s. It's like docs were still going out and hanging out their own shingle and working in small groups. And now most physicians work for health systems. And they're very regimented. You get 20 minutes with the doc once or twice a year. So unfortunately, I have a lot of docs that are primary care docs, and unfortunately, they're relegated at times in those short visits to just disease management, and they don't have a chance to get to the root of the issues like I do in my practice. And then, of course, a lot of forces with industry, and I'm not, I mean, I'm not against a good business model, but the pharmaceutical industry has stepped in and has a pill, or a shot now for about everything. That's an issue as well. And then you layer on top of that the fact that 70% of Americans' consumption now is of processed foods,
Mm-hmm.
which basically are sugar, refined grains, and inflammatory seed oils.
Mm-hmm.
And it's kind of the perfect storm. So people have to, they have the power to manage their own health, and they need to take their own health into their hands.
And yes, and so the symptoms that you see come about from poor metabolic health. And so what you would like to see change is the people's metabolic health. And if you could just describe for our audience what that is.
Yeah, so I think a lot of people maybe are familiar with the term metabolic syndrome, which is being overweight, high blood pressure, high cholesterol, increased abdominal girth, and hypertension, or some constellation of those symptoms. So metabolic health is really the absence of those diseases. And unfortunately, with about 60% of Americans overweight and at least 30% of adult patients having metabolic syndrome. The focus here is trying to reverse those processes. So that's what my practice is. Basically, trying to focusing on reversing disease. It's not only losing weight, but it's reversing prediabetes. So it's eradicated, and patients never progress to diabetes, or in patients with diabetes, at least putting that into remission so that they can get off medications. And of course, with that, often hypertension improve, and even on low carb, high fat diets, I often see cholesterol levels improve and triglycerides almost invariably improve.
So, Doc, how do you actually tackle this issue? What's your approach?
Yeah, so this is what I do. I bring patients in, and as we talked a little bit beforehand, using continuous glucose monitors are a big part of my practice. So I have patients come in. My patients that they select. They're usually overweight and have some type of metabolic health issue, so they self-select to come to see me. And what I do initially is do a full assessment with a continuous glucose monitor for a couple weeks. And for your listeners, probably most are familiar with these, but these are the devices that you put on the back of your arm that you see on the back of the arm of diabetics that they have used to dose their insulin. But they're tremendous tools in non-diabetics and pre-diabetics to get a great understanding of what your blood glucose is doing 24/7. So we put it on the back of the patient's arm, doesn't hurt. They wear it for 2 weeks. They can see exactly what's going on with their blood glucose over that period of time. During that time, we also do a focused assessment of their level of insulin resistance by getting a fasting insulin level and doing a calculation called HOMA IR. Have you talked about that on your show in the past?
No,
No, just
no.
briefly, just a little
Okay.
bit. Yeah.
So just real quickly, a HOMA-IR, it's an acronym that stands for homeostatic model of insulin resistance. And if you if you get a blood level of both an insulin level and a blood glucose level simultaneously, those two numbers have a relationship, because if you have a fair amount of insulin in your system, it should be driving blood glucose into your organs. But if the organs have started to resist that signal from insulin, that's what insulin resistance is, then the blood glucose can be high despite the pancreas continuing to put out a lot of insulin. So that basically indicates that the patient has insulin resistance, and that gives us a target to focus on within a therapeutic program. So, diagnostic phase with appropriate lab tests and a 2-week CGM trial, and then we put a plan together. And that plan, it's actually not rocket science. It is a low carb focus, intermittent fasting, and then of course strength training, as opposed to cardiovascular training, is much more helpful in reducing insulin resistance. And
Right.
again, I believe in cardiovascular training. I think people should do at least a minimum of cardiovascular training. The American Heart Association has guidelines, but I think most middle-aged and older Americans should be spending the majority of their workout time doing strength training
Yeah, and there's
for
a
reasons. Go ahead.
and yeah, I was just
Yeah.
going to say, because as we age, our blood sugar and our insulin tends to be a problem.
Absolutely. We're losing muscle mass as we age. For women, that relates to the issue of
Hmm.
osteoporosis. And then there is the insulin resistance issue. So I usually work with patients over a period of 6 months or so, and we focus on those lifestyle changes. And been doing this well before the mania related to the GLP-1 medications has occurred, and just had great success with people focusing on those lifestyle changes.
So, Doctor, one thing I wanted to just touch on, because we did have a guest who spoke of the glucose monitors maybe a year or two ago. I'm not sure, Lloyd, but is the availability of these like more now than it was back then? I remember when she came on, there was like an issue with, just like you said, people who were not necessarily diabetic having access to them, and it was like a little bit of a uproar about just someone who doesn't have those issues going around getting these
Yeah, I believe there was a physician on board who would write the prescription for it for
Yeah, it
people like
was.
you and me, or
Mhm.
Yeah.
that are
Well,
non-diabetic. Yeah.
yeah, I have some great news for you. Yeah, so the issue is with CGMs has been always an insurance issue, because even at times some diabetics, if they aren't on insulin, they can't get a CGM, or they can get a CGM, but it's not covered by insurance. The
Wow.
cost to them is really not terrible. Out of pocket for most of my patients, it's about 35 bucks for a 2-week monitor. But I got some great news for you, and that is that Dexcom, one of the makers of CGMs, is going to make them available. They just got FDA approval in the last three
Yeah.
weeks. They're going to be available over the counter in the future. Um, and,
I
and
just
and these devices, I mean, the book I wrote on this, The Continuous Glucose Monitor Revolution, the last chapter in the book is CGMs Changed Lives. And, people can hear that, their blood sugar is a problem, and their doctor can talk to them for years about this. But when they see the data on their phone, when they see their blood sugar spiking, when they see high levels for a period of time, all of a sudden they seem to understand. So they're just tremendous teaching tools, really, to help people, redirect their lifestyle habits.
Yeah, that is a really great point. And also, too, there are things that we eat that you see real time that spike your blood sugar incredibly. Eat things like coffee, for example. People wouldn't think that that would happen, but it does to a lot of people. And
Yeah, and
also,
it can be
yeah.
individual specific too.
Yeah, yeah. And the flip side too is some people, you would think white rice would increase your glucose level, and some people it just stays flat.
Yeah, there's a whole science to this, and I
Yeah.
don't know if you talked about that. It's eating your fiber and your protein before you eat the
Hmm.
other carbs. So there's a whole science controlling this, and I work with my patients on that so we can keep their blood sugars relatively low and relatively steady, avoid those blood sugar spikes that result in increased insulin being released and eventually insulin resistance. So CGMs, I think, are tremendous tools to help people learn physiologically what's going on and then help guide their diet long term.
Can you give us an example of the benefit of using a GLP-1 like Wegovy or Ozempic?
Sure. So again, for the last 7 years in my practice, up until the last year and a half or so, we were using primarily the tools that I just mentioned: a CGM guided low carb diet, intermittent fasting, and strength training. Now, the GLP-1s have come out in the last couple of years. Still a lot of issues associated with insurance coverage for those. They're very expensive out of pocket. But my perspective on this is kind of the genie is out of the bottle on these medications, and it's the Wild West out there in terms of people wanting them. There's a bit of a mania. So I actually have integrated them into my practice. But people need to understand when they start these medications that they have potential downsides. Um, the biggest downside is weight regain when you go off the medications. So if you decide that you want to move forward with using these medications, and I use the medications, but with a caveat, which is I use low doses and I use them for limited periods of time. If you use these medications, you have to prepare for the day when you're going to come off these medications. The term I use is, I stole from Stephen Covey in his highly, book of, effective
Effective
habits.
habits. Yeah.
Yeah, and that is begin with the end in mind. If you want to jump in and you just want to take a shot and you want to be on medicine for the rest of your life, you can do that. But that's the wrong way to use these medications.
No, I think your initial way, your book, is the right way.
Yeah, yeah, it's the right way. But I do have people that get stalled a period of time. So we dip our toe in the water.
Hmm.
And the way we do that is with low doses and with a plan, measuring the length of treatment in a period of months, not years. So the way I look at this, Lori and Omar, is for better or worse, the genie is out of the bottle on these things. People are going to seek these medicines. That's unquestionable. And so my goal, rather than have them go, quite honestly, to an internet site where they're going to, spend 15 minutes with an appointment and get enough medicine for the next 6 months and they're off and running on their own. I'm trying to bring people into the fold of educating them about the right way to use these medications, again, in limited doses for limited period of time, with the goal of getting off the medications. And we haven't even talked about the side effect of some of the medications and a huge issue, which is the loss of muscle mass when on these medications.
Oh, wow. That was interesting. We just had someone who was
Hmm.
discussing, those very medications, and she was mentioning like some people have just on the dose, like literally once, and their stomach stopped moving, like working. Have you heard of
Yeah,
that as well?
It's
yeah,
the motility either slows or
yeah.
it stops.
Yeah, the issue
Yeah.
is the technical term for that is gastroparesis.
Mm.
Fortunately, it's a fairly rare side effect. And again, a lot of those side effects are dose related. So if you use lower doses, if you start at lower doses and you continue to use lower doses again for a period of months and not long term, um, that's an option. So, we were doing great managing patients' metabolic health before these medications came out. But unfortunately, the environment now is for better or worse, probably for worse, but the environment now is people are seeking these medications. So I'm trying to one of my goals is to educate people about how to use them correctly, as we just discussed.
Well, you see celebrities like Oprah Winfrey, for example, um, who has, she's, a huge figure in life, right? And
Yeah,
she's lost a lot of weight on it.
yeah.
But what are the potential side effects? You mentioned that there were a lot of them, and we just mentioned one of them that's a rare one, but what are some of the other ones?
Yeah, so a lot of patients have nausea in association with these medications. I'm going to tell you that my patient experience has been good, again, because limited doses, limited periods of time.
Right.
But obviously, if you read the list of problems associated with this, it can be gallbladder problems, pancreatitis. You mentioned gastroparesis, nausea and vomiting, GI motility issues, constipation, diarrhea. Those are really the most common ones. But I got to tell you, in my patient population, I've seen very little of that. I do see
Mm-hmm.
patients that get nausea. Um, but again, it's because we're using it prudently. Everybody's looking for the magic pill or the magic shot. Well, there's no free lunch here. It's important to go ahead and use them prudently, so that you can plan to get off them in a short period of time if you choose to do that. And when I use them, it's in the minority of patients, and it's usually only after they have had a stall in their metabolic health or weight loss
Mm-hmm.
journey.
And you mentioned something about um, muscle loss. I think that that's crucial, actually.
It's huge. It's
Yeah.
huge. Anybody, if somebody is on these medications and they are not doing strength training, that's a mistake. Because they are losing muscle mass with the weight they are losing. We are all losing muscle mass as we age. For women, that has significant impact on the risk of osteoporosis. For men, actually, too, but more so in women.
Mm-hmm.
So if you choose to go down this road, then you have absolutely got to be strength training if you're using those medications.
And you should be strength training anyway.
That's true. Absolutely.
Um, is
Yeah.
is the sagging of the face, which is also, I think, a rare side effect, I'm assuming, part
Yeah.
of the muscle loss?
Yeah, it's part of muscle loss, and you have actually fat in your cheeks too, so you're losing both. But yeah. So these medications should only be used in the setting of a comprehensive program. In my mind, that is low carb with increased protein, intermittent fasting, and strength training, and then in a prescribed program with a goal to get off these medications.
Yeah, no, this is fascinating because again, the muscle component to it is what I love that you dive into, and you talk about a lot in your book, and you mentioned like how muscles soak up insulin and glucose. I think if
Yeah.
you can explain that to the audience, I think they could probably really get on board with that, or maybe get away from like the traditional mindset of just like the whole weight room issue versus cardio and stuff.
Right.
Yeah. Yeah. So I tell my patients this. So the American Heart Association has guidelines for cardiovascular fitness, and you're probably familiar with these. Get your heart rate, to 65% of your max for 150 minutes a week, or 80%, 85% of your max for 75 minutes a week. So that means if you focus on this, you can get your cardiovascular fitness out of the way in 75 minutes a week. A couple 37 or 40-minute sessions doing cardio. I do three 25-minute sessions a week personally. I get my heart rate up to that target heart rate, and then I'm done. And that leaves me a lot of time to spend on strength training, which is important to
Right.
me as I am getting older. So, basically, you should be able to spend three-quarters of your time doing strength training, and you're still meeting the American Heart Association guidelines. The reason muscle mass is huge is because if you can increase the amount of muscle mass, then you increase the quality and the receptivity of those insulin receptors on your muscles. And that helps just do that, as you mentioned, Omar, soak up more insulin, soak up more blood glucose, help you reverse your insulin resistance. And quite honestly, I have another perspective on this after spending years in the emergency department. One of the most important things for each of us individually as we age is maintaining our mobility. And
Mm-hmm.
I see all kinds of patients that just lose their mobility because they don't have enough leg strength. It's not that they have a joint issue or a back problem, or some neurological issue. They just don't have muscle mass in their lower extremities. And so, to maintain your mobility as you age, you want to maintain that muscle mass in your legs. So, the old joke about don't skip a leg day is
Hmm.
absolutely true. Leg day is critical, and the older you get, the more important it becomes.
The
So
largest muscle in our body,
yeah,
muscles, I should say. Yeah.
yeah, yeah.
You
A
know,
large percentage of our
um,
muscle mass is below our waist. Yes.
yeah, the glutes and the thighs, etc. I was just reading, somebody had sent me an email about wall sits and how they markedly reduce blood pressure over cardio. So the traditional prescription from if they say to exercise is to do cardio 30, 40 minutes, right?
Yeah.
etc. But they're saying that physicians should maybe review their recommendations and start having their patients do wall sits.
Yeah.
And I think it's like 8 times 5 days a week, or 8 times 3 days a week, 2 minutes at a
Yeah.
time, something like that. And
Yeah.
that it was a drastic improvement in
Yeah.
blood
Well,
pressure.
probably if you're doing wall sits correctly, I mean, you're getting a little cardio in there too, because, at
That's
least
a
when
good point.
I know I if I'm doing them right, I get tired after a few minutes.
And it builds up leg strength like one wouldn't
Yeah.
believe.
Yeah.
And it's
Leg
not
strength is
hard,
huge.
really. Yeah.
Yeah.
So one way to build up leg strength. And yeah, I mean, the sad part is also too, just to follow up on what you said, people with arthritis, knee arthritis, for example, find that when they have pain from the arthritis, they're afraid to push it, right? They're afraid to
Yeah.
walk.
Yeah.
And we know now that they need to do just the opposite. They need to move that joint.
Yeah, you need to maintain that joint mobility. You need to work through it. And
Hmm.
just as you mentioned, you have knee pain, you stop doing your leg workouts, that's going to have long-term effects as well.
Yeah,
In
to
terms
weight
of,
and metabolic health, right?
yeah, yeah. So those are all huge issues.
Yeah, really huge.
I think I was gonna jump into the fasting component too because it's fascinating. We have a friend of ours who sends us a lot of messages, and he actually brought up this point because of intermittent fasting, and he works out in the morning specifically. What
Yeah.
what was the issue of consuming, say, creatine and BCAAs and stuff like that fasted, and does it break the fast? I'm just curious because I know you have a lot in your book about different fasting regimens, and I was hoping that you can maybe touch a little bit about that.
Yeah, so generally with my patients, provide this guidance and I follow it myself. Some people come to me and they've done some fasting. Other patients come and they have never done any fasting. I generally like to get them to a 14 or 16-hour fast, so like a 16/8. And again, this is because most of my patients are overweight, have insulin resistance, and the best ways to reverse insulin resistance are low carb, intermittent fasting, and strength training. That being said, I know that some people have a regimen where they're going to be working out in the morning, and I do, as I assume you believe, in the anabolic window. So if they need to break their fast to go ahead and get some protein in, whether that be, branched chain amino acids or get some creatine on board, I don't have any problem with that. So it's kind of individually specific. If people have a tendency to work out later in the day and they can do a true fast for 16 hours, that's great. But protein should be the first meal of the day. And if you're doing it
Yes,
in preparation for your workout, I think that's great.
that's
I know.
fantastic. I wanted to ask you about, we're just going harking back to metabolic health. Sugar and refined flour, for example, are really exacerbating this, because we know, like, the latest stat, excuse me, was 156 pounds of added sugar a year per American, right?
Yeah.
The average intake. And they don't realize they're getting that much, but it goes back to what you were saying, is all of that processed packaged food stuff.
Yeah.
I mean, every single product almost out there has it in it. But anyway, my question to you is the glycation effect. I don't think people understand what it's doing in the end. That's really doing harm to our tissues.
Yes. So glucose attaches to everything. So people commonly get a test called a hemoglobin A1C to measure the amount of glucose that has been in their system. I think a lot of people are familiar with that test. All that test is, when you get a number for your A1C, 5.4%. That means 5.4% of the hemoglobin molecules in your red blood cells have glucose attached to them. So the glucose attaches to everything. So glucose attaches to your blood vessel linings. That's why diabetics get vascular issues. And you mentioned, Lori, the cascade associated with the cholesterol. But again, the glucose attaching to the linings of your blood vessels is really a primary reason for the vascular issues that later develop. And I'll tell you one thing I see in my patients recurrently: when they lower their blood sugar, even before they lose a lot of weight, that glucose is attaching to your cartilage and causing joint inflammation as well. So I have patients that, we get a CGM on them for the first couple of weeks. They have high levels, they have spikes. They embrace a low carb approach. They improve those curves on the CGMs, and their knee pain goes away. Sometimes goes away completely. I'm not going to tell you it's necessarily a miracle cure for somebody that has arthritis in their joints, but there's no question in my mind that there's a direct relationship between blood glucose level and joint inflammation.
Totally. I hear it all the time. Yeah, when
Yeah.
people when they have an intake of sugar or junk food, they feel the inflammatory effects, or when they stop it, it all goes away.
Yeah. And we're swimming upstream because, again, I'm not going to demonize the food industry because they're just there to sell a product. Unfortunately, we've allowed this to happen, but it's basically, processed foods are basically refined grains, sugar, and then inflammatory seed oils. And that's 70% of the American diet as well. So at this point. So I always say to my patients, the more ingredients on the label, the more toxic it likely is. So,
Hmm.
go out and get something that doesn't have a label, like a steak,
Yeah, exactly.
something, or broccoli. And then,
Healthiest foods. You pick two of the healthiest foods.
yeah, yeah, well, yeah. And I mean, you can follow your low carb diet, get adequate fiber there, and the fast foods are all fried in the inflammatory seed oils. The history of seed oils, you guys probably know this, is
Hmm.
that seed oils were industrial lubricants. So the at the forefront of that is Procter and Gamble, which is based in Cincinnati, just a few miles from me. And they were industrial lubricants. And then, oil started coming out of the ground in Pennsylvania when we discovered oil in, the 1860s or 1870s. And all of a sudden, they had to find another use for seed oils. And what is that? Oh, we'll make food out of those products. And now they're in everything. And you probably remember, I don't know if you remember, if you're old enough to remember, but it's
I
like,
am, believe me.
you know, in the 70s, 80s, when I was a kid, it's like, oh, you can't eat that butter. That butter is bad for you. You need to be using margarine
Right.
instead,
Oh my
when
goodness.
exactly the opposite is true.
Exactly. Yeah. It's
Yeah.
it's just the opposite, and it's still a mindset. It is so tough to break. I deal with it every day. Yeah.
Yeah, I'll tell you, I'm going to come back to CGMs, because it's a mindset that's tough to break. But I'll tell you, when people see those numbers and the graphs and the variability, they're great tools to help people understand and then redirect their lifestyle to a whole food, low carb diet.
Dr. Bald's, well, you just were fantastic today, and I want to give
Yes.
you an opportunity for the audience to find where we could continuously keep up with all the good stuff you're doing, including this wonderful book that I think is going to change so many lives because it's really a powerful way to see exactly, like you said, these
Mhm.
graphs that just are so shocking and profound when you really know what's going on inside. Yeah, and just his social media handles, website, and like I said, anything else that we
And
can
where
keep
you're
up with what you're doing.
located
Yeah.
again.
Sure, sure. Well, the book is The Continuous Glucose Monitor Revolution, and it is on Amazon. It's actually the best-selling book now on CGMs on Amazon.
Yay.
And
Congratulations.
it's
Mhm.
yeah, it's basically a Bible for how to use a CGM
Mhm.
effectively. And then my medical practice is metabolicmds.com. So it's the word metabolicmds.com. And I am located in Ohio, but I'm licensed in Ohio, Indiana, Florida, and Arizona. This practice lends itself to telemedicine. So I see most of my patients via telemedicine. And then my social media handles, the easiest way to find me is I have a podcast as well called the Metabolic MD. And
Oh,
then on LinkedIn, you can just look up under my name, Paul Kolodzik. It's Kolodzik. And on Twitter, and Instagram, I'm known either as Dr. Kolo, Kolo, or Metabolic MD, and you'll find me.
well, we will
Excellent.
look for you.
Mhm. Yeah,
All
no,
right.
yeah, definitely. So thanks. Have a great
Yes.
rest of the day.
Take care
All
and thanks
right.
so
Thank you for
much.
having me on. All
Thank
right.
you. Bye-bye.
Thank you so much for listening to this episode of This Podcast Burns Fat. We're so excited to have you as a listener, and we're hoping that you really enjoyed the content as well. And if you did, please run over to iTunes and provide a rating and or review. It will go a long way in helping us continuously build our listenership up so that we can provide you with excellent content regarding fat loss, weight management, and just an overall healthy lifestyle. Thanks so much. Have a great night.